Now, there's no doubt that Missouri is ready to meet the challenges of a global economy. But quite frankly, the biggest economic decision facing our state right now is how to move forward on health care. This isn't the time to reopen the debate or re-argue the merits of the President's health care plan. I had some problems with it, and I know many of you did as well. But Congress passed it, the President signed it, and the Supreme Court upheld it. It's the law of the land. And it's not within our power to rewrite federal laws, even if we wanted to. It is within our power. It is our responsibility to now do what's right for Missouri. And the question before us is a narrow one. Will we bring the tax dollars that Missourians send to Washington back home to strengthen our Medicaid system here in Missouri? Or will we let the tax dollars that Missourians send to Washington be spent in other states instead? Other states would get the benefits, we'd get the bill. The answer is clear. The people of Missouri deserve to see their tax dollars come back to their communities. Friends, let's put the politics of health care aside for just a moment and look at this as a business decision for the state of Missouri. The Missouri Chamber of Commerce supports the Medicaid expansion, not because they're big supporters of this president and his agenda, but because it's the smart thing to do. They know that bringing billions of dollars back to Missouri is good for our state's economy. The Kansas City Chamber of Commerce has endorsed the Medicaid expansion. So have the chambers in Independence, Springfield, Lee Summit, and St. Louis. So have the Civic Council of Greater Kansas City, Kirksville-Ready, and our friends at the Associated Industries of Missouri. Would these leaders from these business organizations who have joined us tonight because of the importance of this issue please stand? Thank you for your leadership for our state. Now, for these business leaders, this is not a political decision. It's an economic one. And we shouldn't let last year's politics get in the way of next year's economic growth. Moving forward with this plan will bring a total of $5.7 billion to Missouri for the first 3 calendar years at no additional cost to our state. The University of Missouri estimates this will generate an additional 24,000 jobs, and that's just in 2014. We're talking about good jobs for nurses, doctors, pharmacists, therapists, and medical technicians. Strengthening Medicaid will strengthen our economy. Without question, it's the smart thing to do. I know there are some who have voiced concern that Washington will not live up to its commitment. Let me address that directly. I support including a provision that rolls back the Medicaid expansion if Washington doesn't honor its financial commitment. Washington drops the ball, we'll do what's right for Missouri. Quite frankly, we always do what's right for Missouri. And there's a human element to this that just can't be ignored. A stronger Medicaid system will make health care available to 300,000 of our friends and neighbors. Let me be clear about who these people are. They're working Missourians. Folks who work day and night, but simply can't afford health coverage. These are not people who aren't trying or hoping to game the system. They're folks we see every day. Some holding down 2 jobs just to make ends meet. We're talking about a family of 4 with a household income of roughly $32,000 a year. They wait tables and clean office buildings. They cut hair and trim trees. They work in factories and repair cars and trucks. Making it easier for these hardworking Missourians to get basic health insurance, that's the right thing to do. Because these folks can't afford doctor's bills or insurance, they often end up in our hospital emergency rooms because it's the only option for their family. In their shoes, you'd probably do the same thing. It's a terrible way to deliver health care. It drives up premiums for people who do have health insurance, and that must change. I'm well aware this is a tough issue politically. But across the country, we're seeing governors and state legislators put politics aside to do what's undeniably best for their states. Republican governors in places like Arizona, North Dakota, New Mexico, and Nevada are using federal funds to strengthen their Medicaid systems. Not because it's the easy thing for them to do politically, but because it's the right thing to do. Here in Missouri, we must make the smart business decision, the right human decision, and bring the tax dollars we send to Washington back to work here in Missouri.